Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for the Appalachian Highlands for the week of August 9th, 2020. As I've shown you before, we watch week-to-week changes in the cumulative deaths per million in the United States, and we see that it's coming down and leveling off, but it's not coming down to zero. So it's growing about 5% a week. If we look at Virginia, it looked like it was following the U.S. pattern over the last couple of months, and then possibly looked like it was ticking back up a little bit, and now perhaps leveling off very much at about the same level that the U.S. is. And so it looks sort of like this. Again, that's good news that it's coming down, but not good news that it's not coming down to zero. And I think the reason is because there are different areas of Virginia that are being impacted at different times. If you look at the number of cases, there was a slow increase in the daily number of cases. It dropped and then came back up and may or may not be leveling off now. We'll keep our eye on it. In terms of deaths, again, rose quickly and then came down. Now, these goes up and down. Sometimes when people look at numbers coming down, they say, well, that's good news. I guess we can relax. And the answer is no, not at all, because you can look back and say, wait a minute, there were two distinct times in the history of Virginia when the number of daily deaths went down. So just because they're going down now doesn't mean we can let up. In Tennessee, on the other hand, we've not been able to see this maturation of the pandemic. Early on, we were seeing these 10 to 20% growth rates. Maybe they started to slow down, then they seemed to pick back up again. And this week we saw a 14% increase. So again, while it seems to be coming down a little bit, it's not anywhere close to the 5% where the U.S. is leveling off, and certainly not close to the 0%, the 0 to 1% that Belgium is seeing. And I think the reason for that is that the pandemic is evolving in different parts of the state at different times. This is a map of the cumulative total number of infections. And what you can see is that they tend to be clustered in the urban areas. That's the total number over time. But if you look at the number in the past 2 weeks, the dark counties, which are largely rural, non-urban counties, are the ones where it's evolving. So the epidemic hit Tennessee first in its large metro areas. Now it seems to be spreading into the rural areas. Now, hopefully, once those rural areas are infected, we'll start to see a leveling off in the numbers. Tennessee had a very, very slow increase in the number of cases, and it went up, and now it appears to be level or coming back down. We'll keep an eye on that. But in terms of deaths, it's been growing pretty inexorably. In our region, Northeast Tennessee, you can see both cases and hospitalizations. In the last week, there seems to be a divergence in the lower number of cases, but as I pointed out before, that may be that we're doing less tests, especially when hospitalizations keep going up. So we'll keep an eye on that. In terms of the whole region, again, still looks like it's growing. Maybe it's starting to level off a little bit, but again, it's leveling off at a high level, right? So it's not time to let up. In our region, I started these reports in May, and we saw, a slow increase in the number of cases through the early part of July, and then the numbers started to pick up, such that we've had now almost 26,000 cases in the Appalachian Highlands. We see the same pattern for deaths, relatively few deaths early on, again, and then somewhere around mid-July, the numbers start to pick up. And now we've had 355 deaths in our region. And the pattern looks surprisingly similar to Tennessee overall. Again, Tennessee saw this drop down to where it's growing 10 to 15% a week. It's pretty bad. But as bad as that is, our region looked like it may have come up and then down and then now coming back up to an even higher rate. So again, as the pandemic evolves into rural areas and more distant non-urban areas, we're going to see this growth pattern for a while. And even if the total numbers in the state seem to be coming down, this is not the time to let up. We've got to be even more diligent than ever. All right. So far, Tennessee's reported 120,000 cases and 1,215 deaths. Virginia overall has 100,000 cases and 2,326 deaths. The Appalachian Highlands has had 25,000 cases and 355 deaths. So in Tennessee, about 1% of the known cases have died. In Virginia, it's more than twice that. And in our region, it looks like the Tennessee. Now, you might look at that and go, why would the people in Tennessee be twice as in Virginia, be twice as likely to die as someone in Tennessee? Well, it could be that they're older. It could be that they have higher rates of chronic disease. It could be that their health care isn't as good. I don't think any of those are the reason. I think the real reason is that Tennessee has conducted 24,000 tests per 100,000 population, almost 75% more than Virginia. We're simply finding more cases. And this is critically important because the disease, 80% of the people who get infected are asymptomatic. We simply don't know who they are. If you want to have any chance of controlling the disease, you've got to do more testing. I don't have these numbers for our region, but since our percentages look very much like Tennessee, we're probably testing at about that rate. But if we can do anything, we've got to maintain the things we know individuals can do: masks, social distancing, good hygiene, but we also have to do testing, contact tracing, quarantine, and isolation. This is not the time to let up. Even if the numbers are coming down, remember, they're still at a very high rate. If we can continue to do the things we know we need to do, we will be able to turn the corner and hopefully start seeing a more mature pattern to our pandemic. There's a lot more information about COVID-19 on the College of Public Health website. If you hit this icon, you can see a number of short videos. But if you have any specific questions or if there's any issue you'd like me to cover, please let me know. I'd very much look forward to hearing from you, and I'll try to find an answer for you. Thank you very much.